So just to set the stage for what we're going to be talking about today, currently, if you live in a small town, you're more than twice as likely to die from COVID than someone living in an urban area, which is just a staggering fact when you think about it. And if that's not bad enough, currently, to date, per population, COVID infections are occurring 80% higher among rural communities than urban. So 80% higher per population prevalence of COVID, and you're more than twice as likely to die from COVID. And not surprisingly, vaccination rates among rural counties are more than 10% lower than urban counties. So it is unfortunately a case of lower vaccination rates and not adhering to public health measures in a population that is older, sicker, and poorer in these communities with really fragile workforce availability. And we must just realize that these rural hospitals were never designed for a global pandemic. Rural hospitals do primary care, general surgery. Once you are at the point where you really need to be on a ventilator and ICU, the practice is to transfer those patients. And what we're seeing, unfortunately, is that in many cases, you have community spread, and the urban areas simply can't take a transfer of patients. And that's the reason why during these spikes, the mortality rate just is way more excessive in these small hospitals because of the patients that they're carrying in a setting that they shouldn't be caring for them in these intensive cares, and the inability to transfer in a timely manner. So unfortunately, everything is set up against rural communities. And what we're discussing here now is it time to view rural communities, much like we view long-term care facilities and assisted care facilities, recognizing that these are unique populations at significant risk. And so extraordinary measures should be taken to safeguard these populations. So appreciate the opportunity to join the panel and the ongoing discussion. I appreciate that. And I appreciate the opportunity to grab the bull by the horns and take the most difficult topic right now. Hey, before I do, I have to acknowledge what a spectacular panel you've assembled here today. I really appreciate the opportunity to be on this panel for everyone. And on it, to your question, Sally, I think there are tremendous lessons to be learned in just what Melissa shared with us. Tribal populations have excelled at vaccination rates in many of their nations. So, and I think that is the heart of it. I think from an urban perspective looking in, it's what's wrong with these rural people. And I want to turn that on its head, and I say what is wrong with the urban messaging on this? And Sally, you know this since you live in a rural area. Rural America is about a sense of family, community, civic pride. That is something we have. That's a culture of rural America. And how we've done messaging to date on this, except for tribal populations, is the federal government tells you what you should be doing. And in fact, we're going to be looking at mandates for healthcare workers January 4th. The federal government telling rural Americans what to do is a terrible communication method. It always has been. And you can track through public health how horribly wrong this has gone for 30 years, declining life expectancies among rural Americans. That's why our organization is trying to change the discussion and model what a lot of has been the success among Melissa's community. And that is, let's forget what we're hearing from the federal government. What do we need to do as a community to keep our community safe, our family safe? How do we keep our businesses open? How do we protect our community assets, which are the healthcare workers? And I think this discussion about what do we need to do for civic pride, and I can't emphasize this enough, the really only successful strategy we've seen is a local primary care clinician speaking directly with their patient, saying, I know you personally, I know your family history, and let me share with you why I think the vaccine is a great option for you right now. And we've just had so many success stories of that clinician to patient knowing the community. I argue again that I realize that it's baked in now at a national level about the people who are in their political camps on this. But I think there's room to be made in lessons learned about how we change the discussion to how do we protect us? What do we need to do here? And I go back to my opening statement. COVID really is no longer a national issue as we move forward. It's going to be a rural issue. The numbers are staggering, the impact on this. It's time for us to recognize that rural is not a small version of urban. It is a unique healthcare delivery environment. It's a place where those most at risk have the fewest options available for treatment. And as such, it's a discussion of how do we keep our family, friends, and community safe.